Good morning, everyone, and welcome to Live with Mel. This episode is brought to you by Yellow Cab Company of DC. If you're looking to avoid rideshare prices, then check out the Yellow Cab Company of DC when you are in the nation's capital. The Omicron variant is spreading through the population at lightning speeds. Omicron is much more contagious than any other variant we've seen in the past 2 years. Now, because this variant is so contagious and is moving through the population, many businesses have been disrupted. Over the holidays, we saw many flights canceled because pilots and flight attendants had tested positive for COVID and they had to quarantine. In New York City, many shows were canceled because the cast and crew had COVID and they had to quarantine. We're seeing many businesses struggling to stay open because once one person tests positive on variant, it moves through the population of that business, and many people have to quarantine. Now, while this is more of an economic issue, the CDC has decided to respond. And while the CDC has responded to this, there has been a lot of mixed reviews coming out about what the CDC said. So what's so controversial at the moment with the CDC? Essentially, the CDC has put out recommendations that they are now shortening the time frame that someone has to quarantine from 10 days to 5 days. Now, again, the CDC is saying that this is data driven, that the data coming out is showing that because of the time frame that people are contagious, that people who are asymptomatic only need to quarantine for 5 days. However, there are people, including experts, that are pushing back. They're saying that this new recommendation is more economic driven than taking into consideration the health of the population. Now, initially, when the CDC came out with recommendations, it was 14 days. They shortened it to 10 days, and now we're in this 5-day window period. And they're saying that they're doing this because of the data. In the statement that the CDC did put out, they stated, given what we currently know about COVID-19 and the Omicron variant, CDC is shortening the recommendation time for isolation from 10 days for people with COVID-19 to 5 days if asymptomatic. 5 days of wearing a mask when around other people. Now, with this information coming out from the CDC, what they're stating is, basically, if you have no symptoms, so if you're asymptomatic, if you have no symptoms and you tested positive from the day, you have 5 days that you have to isolate. After those 5 days, for the next 5 days, you have to continue wearing a mask, but you can go out and you can live your everyday life as long as you continue to wear the mask. Now, again, while many people, including businesses, actually primarily businesses, are happy about this shortening time frame, there are people who don't necessarily believe that this is the right thing for the CDC to say. Some people are saying that the recommendation is appropriate for people who are fully vaccinated, but not for people who are not vaccinated. And we are seeing that with the recommendation the CDC has put out, they're saying that this recommendation is for anyone who's asymptomatic or doesn't have any symptoms, whether they are vaccinated or not. Now, Brown University of Public Health, Dr. Megan Ramney said, I'm quite worried. For the unvaccinated, the data doesn't really back up that they become non-infectious after 5 days. Now, again, the CDC is saying that this is data driven, but it looks as though the data is really surrounding people who are actually vaccinated. And Dr. Megan Ramney is saying that even though the data is showing this for vaccinated people, since the CDC has put out the recommendation for everyone, whether or not, that this can cause issues because she is saying that the unvaccinated people can still spread variants after that 5-day period. Now, Dr. has chimed in as well. Dr. Fauci stated, if you are asymptomatic and you are infected, get people back to jobs, especially those with essential jobs. They can get back to the workplace doing the things that are important to keep society running smoothly. Now, statements like that coming from medical professionals is what has a lot of people worried. People are looking to the CDC to make recommendations based on data and not necessarily based on economic issues. Now, because Omicron is spreading so quickly, we're seeing that the economy is taking a hit because of this. Like I stated earlier in the broadcast, over the holidays, airlines had to cancel thousands of flights because they just did not have the staff. Pilots, flight attendants, and many other people working in airports had caught the Omicron variant of COVID-19. And because of that, they did not have enough staff to essentially take care of the amount of people that were traveling over the holidays. And again, people look to the CDC for medical recommendations. But the one thing that we do know is that the airline industry did pressure and put a lot of pressure on the CDC. Now, we do know that Delta Airlines, JetBlue, and American Airline did go to the CDC and they did ask the CDC to shorten the time. They did this after they had to cancel all the flights. And a few days after these major airlines started applying pressure to the CDC, that is when we're seeing big changes happening. We're seeing the isolation period cut down. Now, again, there are mixed reviews about what the CDC is doing. There are a lot of mixed reviews coming out. Recommendation. People want to see more of the data. However, companies, and one of the biggest companies is the airline companies because they're being hit the hardest. They're one of the companies that are being hit the hardest. We're seeing that essentially they lobby may not be the right word, but they pressured the CDC to cut it down to 5 days. They're saying that 10 days are too long and they could not survive with people being out of work for 10 days. And they wanted to cut that to 5 days. Now, people are really looking at the CDC to see whether or not this was data-driven or if this was driven by economics. Now, again, data coming out about vaccinated people do line up with what the CDC is showing. However, the CDC is making recommendations for not just vaccinated people, but unvaccinated people as well. And they've also made the recommendation that if people are start better, from the day they start feeling better, they have 5 days to isolate as well. So again, so people who had symptoms, the day they start to feel better, they just need to isolate for 5 more days. And this is coming from the CDC. Now, the one thing the CDC is saying that is, if you have a fever, that you need to continue to isolate until that fever is gone and then add those 5 days on. So the CDC also stated the change is motivated by science, demonstrating that the majority of the SARS-CoV-2 transmission occurs early in the course of an illness, generally in 1 to 2 days prior to the onset of symptoms and then 2 to 3 days after. Therefore, people tested positive to isolate for 5 days, and if asymptomatic at the time, they may leave isolation if they can continue to mask for 5 days to minimize the effect or the risk of infecting others. What the CDC is saying, and again, businesses are champions of this. However, there are many people who believe that the CDC is just essentially hanging them out to dry. That the CDC is putting these recommendations in order to please businesses, in order to protect the economy. Now, at the end of the day, COVID-19 has hit the economy hard. It devastated the economy. We saw the supply chain break down. We saw a lot of people not being able to return to work. And the United States can't necessarily deal with a huge economic disaster at the moment. But does that mean that the CDC should put these recommendations in place to protect the economy rather than protecting people? Now, again, many experts are saying that the recommendation is fine for vaccinated people, but not unvaccinated people. Now, while the major airlines did essentially rally together to push the CDC to cut the recommendation from 10 days to 5 days, unions within the air industry have another thing to say. So Sarah Nutt, international president of the Association of Flight Attendants Union, stated, already the lack of pay creates pressures on workers to come to work sick. Corporations that fail to recognize this with paid sick leave or pressure to come to work sick or face discipline are failing their workers and their customers. So again, unions are upset about this and essentially saying that these unions should not listen to a recommendation and they should allow people to stay home if they're sick. While businesses have a hard time functioning without the proper staff, if people come back too soon, if people feel pressured to come to work when they're sick, it could cause a bigger issue down the line. Yes, having people come back within 5 days can help businesses now. But if someone is asymptomatic and they think they are, and they're not vaccinated, and they come back before they should, they can essentially spread it to many, many more people. And this can have a huge impact on the health of people in the United States, but also on the economy as well. Too early can cause Omicron to spread even quicker. But guys, what are your thoughts? What do you guys think? Let me know in the comment section below. What are your thoughts about the CDC shortening the isolation period? Do you think that it's appropriate? Do you believe that they are doing this because of the data, or do you think they're doing this because of pressure from major corporations like the airlines? And then let's go ahead and go to the comments. Joanna said, I believe they have shortened the time of quarantine because of staffing shortages at hospitals, airlines, businesses, etc. Joanna also states, so what happened to all the studies by the CDC that an individual is still contagious for 10 to 14 days? Now, people have been talking about this. And essentially what the data is showing, the data that we have, the CDC has more data than we have, and that's how they're making their decision. But the data that we have, the data that's coming out, is showing that the main difference between the 14 and the 10 days and the 5 days is vaccination status. That being vaccinated allows you to isolate for a shorter amount of time. And one of the biggest issues that people have with this, now people have many issues with this. It's not just one issue. This is something that people are going back and forth about. But one of the big is that the data is really there for people who are vaccinated and not there for people who are not vaccinated. And that's why they were able to show this data. But again, they made the recommendation for everyone, not just for people who are vaccinated. And that's what a lot of experts are having issues at the time. Now, again, many states, many businesses into this new CDC guidelines. California is changing to this new CDC guidelines. The airlines are now changing to the new CDC guidelines of the 5 days. Now, there are people, there are businesses who support this. And then there are people and experts who do not support this and who do believe that this can cause bigger issues in the next couple of weeks and the next couple of months. At the end of the day, we have to wait and see because the CDC has made their decision and it doesn't look like they're going to take back this recommendation. But again, this recommendation has caused a lot of debate. There's a lot of mixed feelings about this recommendation. And we just have to wait and see how things play out now because the CDC made the recommendation and businesses are going with it. At the end of the day, one of the driving factors for this is the economy. One of the driving factors for this is that businesses cannot stay open with the staffing issues at the moment. Even with Dr. Fauci's statements, it's showing that this is driven. And again, I'm going to read that quote from Dr. Fauci once again. Fauci stated, if you're asymptomatic, you are infected, we want to get people back to jobs, especially those with essential jobs. They can get back to the workplace doing things that are important to keep society running smoothly. So even with what Dr. Fauci is stating, it looks as though this is driven by economic factors rather than healthcare factors. So we have to wait and see. Again, many people are debating this. Some people are against it. Some people are for it. Businesses are definitely for it. We're seeing unions try to push back. We heard what rep stated for the flight attendants union. So at the end of the day, people are going back and forth on it. But businesses are adapting to this new guidelines, and we're just going to see whether it works or not. Now, one of the things Omicron is that we are in a situation where the CDC is shortening the guidelines, right? They're shortening the days. But while the CDC is shortening the days, on Monday, the same day that the US announced, the CDC announced that they are shortening the guidelines, Monday, the US reported more than 500,000 new COVID-19 cases, worse than any other single day since the beginning of the pandemic. So we're seeing that Omicron is spreading quickly. Now, the one good thing is that hospitals aren't being overwhelmed like they were before. And we'll see if recommendations like this allow it to stay the same, or if it causes to go to the hospital. So guys, thank you so much for tuning in. My name is Mel. I come live every single Monday through Wednesday to talk to you guys about current events and let you know what's happening across the globe and right here in this great nation as well. And I want to know what you think. If you think that this is the right recommendation, let me know in the comments below. If you believe that this is the wrong recommendation, let me know in the comment section below. If you agree with me, that's great. If you disagree with me, that's great as well. I want to know what your opinions are. So guys, thank you so much for tuning in, and I will see each and every single one of you bright and early tomorrow morning. Again, let me know what you think about the recommendations in the comment section, and I'll talk to you guys tomorrow. Have a great day, everybody.